In my previous video, I have talked about dialysis and when is it required, who should go for dialysis and why it should not be feared. Today I am going to talk about what are the different types of dialysis and what are the differences. I am Dr. Tanmay Pandya. I am a nephrologist practicing as senior consultant and head of department at Sarvodaya Hospital in Faridabad. My clinical practice is also in Hospital in South Delhi. So when we talk about dialysis, we generally talk about hemodialysis, यानी कि खून का dialysis जिसे कहते हैं, and hemodialysis is done in hospital where patient is required to go. There is a big dialysis machine. Patient is connected to the machine. There is a filter and blood gets purified. But यही एक तरीका नहीं होता dialysis करने का. और एक तरीका होता है जिसको peritoneal dialysis कहते हैं, यानी पानी का dialysis. Peritoneal dialysis depends on patient's internal organs and internal membranes, and this is done without any blood flow, without any filters attached to the outside. Peritoneal dialysis is done at home, is done by the patient herself or himself, and can also be automated with the use of a machine. It is equally effective as compared to hemodialysis, and the quality of life, the results, outcomes are comparable in all aspects. However, there are certain limitations because of which peritoneal dialysis is not very popular. It could be cost, it could be a lack of awareness, lack of availability of material, or certain other prejudices like fear of infection. But ऐसा ज़रूरी नहीं है कि हो. The infections and complications common है दोनों तरीके के dialysis में. If we talk about hemodialysis, there are some certain subtypes of hemodialysis. This is applicable in certain clinical scenarios. जब हम डायलिसिस की बात करते हैं तो हीमोडायलिसिस मोस्ट लाइकली सेंटर में हफ्ते में 3 बार 4 घंटे के लिए हो रहा होता है. बट देयर आर कंडीशंस व्हेन द पेशेंट गेट्स हॉस्पिटलाइज्ड, इज इन द आईसीयू एंड रिक्वायर्स स्पेशल ट्रीटमेंट. हियर you have a dialysis which can be done in a gentle form where the blood pressure fluctuations are minimum and can be done over a period of 8 hours, 6 hours, 12 hours depending on the patient's condition. This is known as SLED. And there is another modality which is known as CRRT. CRRT is basically a continuous renal replacement therapy. It is applicable in very critically ill patients who are typically admitted to the ICU, who have blood pressure fluctuations, who have undergone some major surgery, may have undergone a brain surgery or a liver transplant, for example. They may have a cardiac condition. This is another modality of dialysis which is suitable for patients who are extremely sick, who have low blood pressures, who need blood pressure increasing medicines in the dialysis. Talking more about peritoneal dialysis, एक आसान तरीका है डायलिसिस करने का. पेशेंट अपने हाथों से अपने घर पे कर सकते हैं और उसके लिए पेशेंट को थोड़ी सी ट्रेनिंग चाहिए होती है जो एट द बिगिनिंग ऑफ डायलिसिस हम प्रोवाइड करवा देते हैं पेशेंट को. एक बार पेशेंट इसको कर लेते हैं तो उनको कॉन्फिडेंस आ जाता है एंड देन दे कैन कंटिन्यू डूइंग दिस फॉर अ लॉन्ग पीरियड ऑफ टाइम. I promote peritoneal dialysis because it gives patients a sense of dignity and sense of independence, which is very much required to boost up the morale. और तो और पेशेंट्स इसके अंदर काफ़ी इंडिपेंडेंट हो जाते हैं और अपना डेली रूटीन एक्टिविटी अच्छे से कंटिन्यू कर सकते हैं. दैट्स अ प्लस पॉइंट ऑफ peritoneal dialysis. बट इन कंक्लूजन, whether it is hemodialysis or whether it is peritoneal dialysis, both are modalities for treatment of kidney failure, and both are lifelines in the event of kidney failure. So patients should not shy away from dialysis, and when required, when advised by a nephrologist, dialysis should be taken up as a treatment or modality or a treatment in the logical next step towards getting better. Thank you.